Mélisande Rouger for Diagnostic Imaging Europe. I'm here today in Valencia at ESGAR 2023 with its president, Dr. Asunción Torregrosa. Hi Asun, thank you so much for joining.
Hi Mélisande, thanks for inviting me.
Of course. So can you tell us a little bit about the highlights of the Congress this year?
Yes, actually the first highlight I thought when we were preparing this meeting was how to attract people for the first day, the day of the postgraduate course, that it's a monographic way. In this year we call fire in the abdomen, in order to deal with all the inflammatory diseases and conditions that affect the abdomen. Maybe another highlight is the Advanced Ultrasound Center for share knowledge about the more advanced technical in ultrasound, such as contrast enhancement ultrasound, that is really useful for ultrasound, and probably the creation of the very talented Young ESGAR people that are dealing with her own problematics in how to research, how to teach, how to do well their residency. I think maybe there could be the three more important or highlighted things in this meeting in Valencia.
Okay, so almost 2 years after the pandemic, do you think participation is back to its traditional level?
Definitely, definitely, yes. I think not only for this meeting, for other meetings in other countries I have the opportunity to go. People were waiting for the opportunity to get together, be face to face, sharing their knowledge face to face, because the technological tools that the pandemic gave us is really interesting, and we can apply, are really useful. But in a big meeting as a European meeting, I mean in a supranational meetings, the opportunity to be face to face is very interesting.
How many people have registered to the Congress this year, just to give us an idea?
Yes, this year in Valencia, 1,500 participants.
Okay, great. So yeah, really back to its normal track.
I think so.
Okay.
I think it's good numbers. We are very proud of attract so many people to visit Valencia, to be with us.
Well, yeah, about Valencia, this is your home. You work at the iconic La Fe Hospital. Can you tell us about your projects there?
Yes, I'm the responsible of the abdominal department in the medical area, imaging area in La Fe, and now we are focused our our efforts in oncology. Maybe the oncology is the main topic that we are working very hard, combining artificial intelligence tools, working with another kind of professional, not doctors, I mean biomedical engineers and informatic engineers, working together in order to create and how to use these artificial intelligence tools for improve the management of the oncologic patient, because for us obviously the patient is in the center on our work. And
particularly I think hepatocellular carcinoma is one of your strong points,
yes,
right?
I am obvious, and I'm here, I'm an abdominal radiologist, and especially I'm focused on liver diseases and liver cancer. So we are working in La Fe Hospital with a high-level high-level professionalism in liver cancer. I mean, with a lot of liver transplantation. We have many meetings with liver surgeons, hepatologists along the week in order to manage this special kind of patient that have a disease like cirrhosis and a special cancer that affect them as the hepatocarcinoma.
Right.
So maybe in my area, in abdominal area, oncology and hepatocarcinoma are the main fields in particular.
Okay. On top of all this, you're also president of the Spanish Society of Radiology, the CERAM.
I am.
Can you tell us about your agenda for the coming months?
Yes, my agenda is not for the coming months, for the coming weeks, maybe, because as you know, Spanish Society of Radiology has a good relationship with French Society of Radiology and Italian Society of Radiology. And next week we are going to Paris for meeting with these radiological societies in order to share common problems. Now we are trying to deal with the multidisciplinary, the role of the radiologists in the multidisciplinary boards, because this task for radiologists has become a very consuming time, very demanding, because all decisions that are made in the multidisciplinary teams. So this is one of the topics that we are discuss with them, and of course prepare or continue preparing the next national meeting of CERAM, that it will be held in Barcelona in 2024. So we are now deciding or we are closing the scientific program. We are now with this kind of details. And because the venue is already decided, is in the center of conventions in Barcelona.
Great.
It's a great
location.
A great location next to the beach, and it's really nice. And we are dealing with the last part of the scientific program.
Okay, so a lot of work for you there as well in the coming weeks.
Yes.
Okay. Well, thank you so much, Asun, for your time.
Thank you, Mélisande.
That was Mélisande Rouger signing off for Diagnostic Imaging Europe.